are back. We had food. Okay,
yes.
We had nasi
I'm
lemak.
hungry now.
Right, never mind. Nasi lemak after this, right? Okay, now before we have our nasi lemak, we also have to announce Spirit of Rugby. Okay, how do you obtain tickets? Basically, call 2287-2278. That's 2287-2278, or go to www.spiritofrugbychallenge.com. Okay, so well, that is where you can actually go do your research and also get your tickets. It's going to be quite exciting. Kelana Jaya Stadium on the 12th of June, 2010.
12th of June, yes. The website again is
www.spiritofrugbychallenge.com.
Yeah. And you can get more information from that website. And of course, we are moving on to something that's close to
the heart. According to Dr. George Lee, he says
the heart, but it's a different area.
Anatomy altogether. But he says it's a matter of a broken heart. So let's find out what he is trying to tell us.
Yes, Dr. George Lee in our midst. Good morning.
Yeah,
doctor.
good morning.
Yes.
What an exciting day.
Exciting.
Football, rugby,
Yeah.
you know,
ED.
international
Yeah,
stars.
and then you end it with ED.
Of course, it's the climax of the show.
It's like bringing
No pun
everyone
intended.
on a testosterone high and then go like, pew,
Well,
ED.
actually, it's about health,
Okay.
right? Okay.
Right.
Of course, you know, ED is a sign of broken heart. You know, you can interpret it many ways. But what I'm trying to say is that, of course, ED is something that it's a condition that affects many men in Malaysia. And in fact, there's recently a study done by Asia Pacific Sexual Health and Overall Wellness actually shows that below 40, you get about 26% of men experience ED to some degree. And that's quite alarming.
40.
That's right. You know? And
Interesting.
then above 40, of course, we all know that with age, certain performance might be deficient. And then that's true. And then that can go up as high as 48%. And that is a reflection and it mirrors what the Western country shows. And in fact, this is quite alarming in a way that, you know, if you look at this, Malaysian men, you know, like these are several grades of ED. If you look at grade 4, actually is normal.
Okay.
But anything that is below grade 4 actually is ED. So
Okay.
1 is poor, 2 actually is, you know, intermediate, and then 3 is suboptimal, and 4 is good. So if you look at that, then you will realize that about 48% of Malaysian men above age of 40 may experience this. And why it is worrying? Because, you know, a lot of people say, you know, after age of 40, you know, sex may not be something that's important anymore.
Right.
However, it is a sign that something else has gone wrong because the vessels that supply that part of the organ is a lot smaller. So whenever the vessels itself start having problems, it means that the rest of your body, the other organs might actually have problems. So, you know, our lifestyle that actually have increasing diabetes patients,
Right.
high blood pressure, high cholesterol, and these are the people who actually may have first sign of something that has gone wrong. So if you look at this is the Asia Pacific Sexual Health and Overall Wellness Study.
Men and
it showed
women.
that, men and women. This is men's perception that actually 45% in the whole Asia Pacific region of men suffers from ED. And it's mirrored by women's perception as well. Women also rated about 48%. So across Asia Pacific, it's similar that this is a true problems.
Right.
And so as the show like this, number one, it works well because it breaks down taboo to
Yes.
talk about,
Yes.
you know, this is a sexual health problem.
Exactly.
Number two, it highlights something else is even more important, which is an early sign of a broken heart. Because the heart itself is going to suffer. Because if the
Yeah,
vessel
true.
in the other organ is suffering with blockage, with nerve problems, with diabetes, high cholesterol, then the real heart had the early sign of suffering.
So it's actually literally.
Absolutely. So it's an early sign of broken heart.
That's what you meant.
Yeah. So, and also metaphorically, it also can be a broken heart because for a lot of men who suffers from ED, it can also mean a broken relationship.
Right.
Yeah, because a lot of men probably have to suffer in silence.
Yeah.
Because it's an ego problem. You know, people worry about talking about it, and this might actually cause a distance, a barrier between a loving relationship, and that is quite worrying because these days and age there are many things that we can do.
Right. Good. Tell us about the remedies then to allay the fears, especially because a lot of
Or
men.
prevention, perhaps.
Right. I'm sure a lot of men are actually, like you said, apart from the ego thing, they're also terrified.
Absolutely.
They're terrified.
Men are very sensitive, very terrified. That's right.
Understand.
So, yes, it's true. So there are two topics here. Zamil is absolutely right. It's prevention. Prevention is key in here. And then treatment is the second part. Prevention is important. We know that what causes ED are the same thing that causes the first killer in Malaysia, such as strokes, heart attacks. And then those are the things such as smoking, high blood pressure,
diabetes,
high cholesterol, and diabetes. And these are the main killers of heart conditions. So the way to do it is obviously watch what you eat, and then live a healthy lifestyle, stop smoking, stop drinking or reduce on the alcohol, and have a balanced nutrition, a balanced diet, and exercise. And then that will be the key to have a good lifestyle and prevention of erectile dysfunction. And coming to the treatment, right, of course, for those people who actually had suffered from the condition, it might be a little bit too late. However, nothing is ever too late. There are studies to show that if you live a healthier lifestyle, and things can continue to improve. So they may be reversal, because the damage of the blood vessels can continue to improve whenever you live a healthier lifestyle. So guys out there, don't be despair. Exactly. So go back, exercise more, and eat healthier have a healthier lifestyle, and that may reverse the erectile dysfunction.
Well, Doctor, since we are talking about football and rugby today, all about sports, do athletes actually suffer ED?
Well,
will they, somehow suffer ED?
Yes, there are other causes of ED apart from unhealthy lifestyles. That includes medication. So certain people may take certain type of medications, like for example, atenolol. This is a drug that actually may cause ED. Some cancer may result in ED, for example, prostate cancer, and also treatment of prostate cancer. So a healthy athlete may suffer from ED for other reasons. And of course, there is the psychological cause of ED, and that may be related to performance anxiety. So therefore, go and see a doctor, because the doctor can establish what is the real cause of ED and help you accordingly.
Great. Now, coming back to remedies, Dr. George, curiously, are there any pills or medication to be taken, like you said, to alleviate the symptoms or to help people on the stage of recovery? Absolutely.
And in fact, the blue pill, the famous blue pill, has been around for about 10 years.
10 years, yeah.
That's right. And then there are many other pills that's available, and these pills actually help to open up the blood vessels, and then that will solve a lot of problems. And after 10 years, we know that they are safe, but they need to be taken under the guidance of a doctor, and that's very important. And also, apart from that, the drugs itself may work in 80% of men. For those men who it doesn't work, there are other ways, such as medications through injections and also several devices that may be used in order to help men. So they need to be tailored. So the best thing to do is actually see men and women together, the couples together, and see how we can actually prevent that.
Great.
And from your observation, Doctor, how young a Malaysian could suffer from ED?
Well, I second ED can happen in younger age, probably about 20s. And then for men who suffers younger, they may actually be due to psychological reasons. And therefore, it is true, it can happen in younger age group. So seeing a doctor to check out this might not be a hormonal cause or any other psychological etiology will be very important.
Great. And lastly, Dr. George, maybe in terms of counselling, I know men, when they hear counselling, maybe no, maybe not for me, right? But do you actually encourage or prescribe counselling, especially for couples? Because, like you said, it could affect their relationships, and it could be quite serious.
Yes. Counselling is it's something that I don't do. And then counselling actually is important because in relationship, because sexual health is a couple's problems, and counselling obviously is important whenever this affects the relationship, because after you rectify the erectile dysfunction, there is that mending of a relationship that's important. And I am somebody who's not qualified counsellors, and however, what we need is a doctor or healthcare profession who actually listen to patient and trying to see how to bring the two broken hearts together again. And that's the most important part.
Right.
Well, guys, we hope that you have been really informed from this topics that we have discussed today. Let's take a look in the polling results. Let's just in and see what you have voted for.
Right. Before we hear our last word from Dr. George Lee, that is.
Okay, so who do you think will be in the World Cup 2010 finals? 50% of you has voted for
Holland.
Brazil.
Sorry.
Brazil.
Oh, goodness.
20% goes to Spain, and Holland goes to 30%.
Holland was my choice.
Oh,
really?
no, this is too obvious. It has to be underdogs like, Australia or something
Well,
like that.
well, we'll get to that.
Yeah,
okay, we have
no.
got a whole month.
For
Okay,
me, it has to be England.
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 EPL. But anyway, well, Dr. George Lee, before we go off air and talk about World Cup, any last words for men out there about ED or women out there about ED?
Well, sports. Last word, since we're on the spirit of rugby, spirits of World Cup, why don't you take this opportunity and join the nation and live a healthy lifestyle and stop yourself from getting problems like ED.
Thank you so much. To mend your broken heart, Dr. George Lee. Thank you so much.
Thank you.
Right,
My
thank
pleasure.
you so much.
Well,
And
Angeline and Zamil signing off for the day. We wish you a pleasant day ahead and stay tuned for the World Cup opening.
2010,
Tomorrow.
enjoy!
Yeah.